What is breastfeeding? Breastfeeding is when you feed your baby breast milk, usually directly from your breast. It's also called nursing or chest feeding. Making the decision to breastfeed is a personal matter. It's also one that's likely to draw opinions from your friends and family. Many medical experts, including College of Pediatrics and obstetricians and gynecologists, strongly recommend breastfeeding exclusively for 6 months. After the introduction of other foods, it recommends continuing to breastfeed through the baby's first year of life. How often you should breastfeed your baby depends on whether your baby prefers small, frequent meals or longer feedings. This will change as your baby grows. Newborns often want to feed every 2 to 3 hours. By 2 months, feeding every 3 to 4 hours is common, and by 6 months, most babies feed every 4 to 5 hours. You and your baby are unique, and the decision to breastfeed is up to you. Benefits of breastfeeding. Benefits of breastfeeding for the baby. Breast milk provides the ideal nutrition for infants. It has a nearly perfect mix of vitamins, protein, and fat, everything your baby needs to grow. And it's all provided in a form that's more easily digested than infant formula. Breast milk contains antibodies that help your baby fight off viruses and bacteria. Breastfeeding lowers your baby's risk of having asthma or allergies. Plus, babies who are breastfed exclusively for the first 6 months, without any formula, have fewer ear infections, respiratory illnesses, and bouts of diarrhea. They also have fewer hospitalizations and trips to the doctor. Breastfeeding has been linked to higher IQ scores in later childhood in some studies. Breastfed infants are more likely to gain the right amount of weight as they grow, rather than becoming overweight in childhood. The AAP says breastfeeding also plays a role in the prevention of sudden infant death syndrome. Breastfeeding has been thought to lower the risk of diabetes, obesity, and certain cancers as well, but more research is needed. Breastfeeding benefits for you. The physical closeness, skin-to-skin touching, and eye contact all help your baby bond with you and feel secure. Breastfeeding burns extra calories, so it can help you lose pregnancy weight faster. It releases the hormone oxytocin, which helps your uterus return to its pre-pregnancy size and may reduce uterine bleeding after birth. There are continued benefits from breastfeeding beyond 1 year, and up to 2 years, especially in the parent. Breastfeeding also lowers your risk of breast and ovarian cancer. It may lower your risk of osteoporosis, too. As you don't have to buy and measure formula, sterilize nipples, or warm bottles, it saves you time and money. It also gives you regular time to relax quietly with your newborn as you bond. Are there medical considerations with breastfeeding? In a few situations, nursing could cause a baby harm. You should not breastfeed if you are HIV positive. You can pass the HIV to your infant through breast milk. You have active, untreated tuberculosis. You're receiving chemotherapy for cancer. You're using an illegal drug, such as cocaine or marijuana. Your baby has a rare condition called galactosemia and cannot tolerate the natural sugar, called galactose, in breast milk. You're taking certain prescription medications, such as some drugs for migraine headaches, Parkinson's disease, or arthritis.